He's a world-renowned, multi-platinum, Grammy Award-winning artist living with a debilitating disease that is unfamiliar to many. Now he's using his personal health journey to help and inspire others. Join me now as I talk with Imagine Dragons lead vocalist, Dan Reynolds.
Well, Grammy Award-winning band Imagine Dragons is a musical success story whose phenomenal rise to fame is nothing short of amazing. And frontman Dan Reynolds is able to put it all off despite living with a painful chronic autoimmune disease called ankylosing spondylitis, or AS for short. The condition usually affects the spinal joints, but can affect other joints as well, including the neck and hips. I'm catching up with Dan now to talk about the band's incredible success and its role in a new health awareness campaign. Thank you so much for joining me today.
Of course. Thanks for having me.
And also joining him as well as Rheumatologist Dr. Norton, who also has AS. Thank you for joining me, Doctor.
Thank you for having me.
Now, first, Dan, let's talk about Imagine Dragons and all of the success you guys have achieved in such a long time. A host of chart-topping songs, plus a Grammy Award. How has the musical journey been for you thus far?
It's been incredible. I mean, it's every kid's dream, I think, to play in a band when they get older. But yeah, I mean, music is everything to me. It's been my passion since I was a little kid. And so I feel very lucky every day to be doing what I love.
Absolutely. Now, your latest album, Evolve, is still going strong. The newest music video for the album, Next to Me, is phenomenal, and you're touring this year as well. Now, is there anything else that's on the horizon for the band that we should look out for?
Yeah, I mean, my focus has really been on spreading awareness about ankylosing spondylitis, and then also I started a foundation recently called the Love Loud Foundation to raise awareness about our LGBTQ youth, especially within the walls of Orthodox religion, and what we can do to provide a safer space for them.
That's great. Now, Dan, as we've said, you are indeed a busy guy. Tell us, how do you successfully manage everything in your daily life while living with the condition AS?
You know, fortunately for me, I have a great rheumatologist who I work very closely with to have a treatment plan that keeps my ankylosing spondylitis, also known as AS, in check. And, you know, it took me many different doctors and misdiagnoses to get to a proper rheumatologist, so that's why I'm really passionate about raising awareness for AS. Alongside with Novartis and the Spondylitis Association of America, we have this campaign to help people know what AS is. So it's not an invisible disease, so that people are diagnosed quicker. And yeah, that's my goal, is to raise as much awareness as I can.
Absolutely. Now, you touched upon this a little bit. Can you share more with us about what led you to seek out a physician, and how were you diagnosed?
Yeah, so I was in a lot of pain, mainly my lower back, hips, and I went to a doctor. They said, oh, I think it's sciatica. Sent me a different doctor, did x-rays, different doctor. A lot of misdiagnoses, and then after a year, I finally went to a rheumatologist who said, this is what it is. It's ankylosing spondylitis. We did the work to kind of lead up to that diagnosis, and then got on a treatment plan, and I'm doing great now, in a very healthy place. You know, between my diet, exercise, and treatment plan with my rheumatologist, I'm really in a great place. And so, yeah, I think it's people like Dr. Norton who are out there on the ground, you know, that are helping people who are really confused about why they're experiencing this severe amount of pain, and helping them get out of the world of misdiagnoses and to actually start a treatment plan.
Indeed, and so good to know that you're doing better. Now, there's an entire community of people living with AS just like you, which is part of what your awareness effort is about. Dan, tell us more about it, and what else do you hope to accomplish through your awareness effort?
Yeah, there's really a great community of people who have AS. Two places that I would recommend to anyone is thisaslife.com, stopAS.org. Both great sites to become educated on AS and to also find a community. We've been doing a series of videos called This AS Life Live on thisaslife.com, where I'm talking with people from the community and talking about AS and what they do in their life to combat that, tips and things like that. But yeah, I think you know, as much as I can raise awareness about that, that is my goal. And you know, Dr. Norton can speak better to kind of the ins and outs of ankylosing spondylitis and what it is and how it rears itself and how to combat it.
Yes, and Dr. Norton, over to you. You are a rheumatologist who also has AS. Can you give us a little more background on the condition?
Absolutely. So the reason that Dan and I are so passionate about this is because most of the time when I diagnose somebody with AS, they've never even heard of it before. And so that lends itself to this long delay in diagnosis. And all that goes on during those years can be kind of scary. We're trying to point people towards resources to help prevent that. But this comes on when people are young, in their 20s, when people develop back pain. So generally they don't seek care immediately, and when they do, they often see other physicians before seeing a rheumatologist and really getting treated properly.
So what advice would you like to share with others to help them manage the disease if they have it in order to maintain a healthy lifestyle? Or, as you said, if it's someone who suspects they may have the disease, how should they go about getting that proper diagnosis in a quicker manner?
Sure. So, you know, the big difference is that this is inflammatory back pain, not mechanical back pain. So this is pain that is worse at night. It has a lot of morning stiffness. It tends to get better with activity. So if a young person comes down with back pain, it's not going away, they're having a lot of night pain, that raises some red flags. So I would say sites like you know, stopAS.org and thisaslife.com are really good places to start getting information. If you think that you do have this, then seeing a rheumatologist for the correct diagnosis is really important, because there's no one treatment plan for AS. Everybody's different. So the approach is going to be different, and you're going to work with your rheumatologist to figure out how to manage this disease.
Great, thank you for that. And any last minute tips for someone in terms of just the day-to-day life? I know that Dan mentioned exercise and diet. Tell us, what roles do those play in helping people live with AS successfully from day to day?
Oh, they play a huge role. So, you know, Dan and I can tell you that whenever we get together as AS patients, we're going to talk about our workouts because exercise is very important for us to manage this. And exercise looks different for everybody with AS. Healthy eating, as he mentioned, is really important for all of us. So avoiding inflammatory foods like sugar, not smoking, which has been connected with worsening of AS. Getting enough rest, all of those healthy lifestyle things are crucial. We pay a bigger price when we don't live a healthy life and we have AS.
Thank you so much for sharing those tips with us. And again, for more information on the condition, you can visit spondylitis.org. You can also be sure to check out the social support and awareness community for people living with AS at thisaslife.com. And of course, be sure to see Imagine Dragons out on tour this summer. Thank you so much, Dan and Dr. Norton, for joining me today. It's been a pleasure.
Thank you.
Thank you for having us.